Welcome to Compassion Speaks, where we give a voice to the nonprofits in the community. I'm your host, Stephanie Player, and today on our show we have Timberly Perkins, the Center Director, and Lindsay DiCamillo, the Family Advocate from Pinetop Head Start. Welcome, you guys.
Thank you for having us.
Oh, thank you so much for coming. I'm really excited to have you on just because what we talked about a little bit earlier with my involvement in the organization in the past. But let's just kick it off. What is Head Start? What's it about?
Head Start's a program that works diligently to improve at-risk families and children in our Arizona. That's awful.
In northern Arizona.
In northern Arizona, right? From birth to kindergarten. Okay. We serve children birth to kindergarten. We have Head Start centers that serve children 3 to 5, and then we also have Early Head Start that serves children 0 to 3, and we also have home-based programs as well.
Awesome. So this is early childhood education, and I think a lot of people have some misconceptions about what Head Start is. So let's go over some of the misconceptions real briefly of what people usually think Head Start is, but what it actually provides, what it actually does.
I think typically most people think Head Start is a daycare facility. When in reality we're actually a preschool. We do have curriculum that we use, and we have assessment systems that teaching staff use to help children reach the levels they need before they enter into kindergarten.
Awesome. So it's setting them up. It's setting them up and getting them ready for school. So I can attest, it's not a daycare situation. They're educating your children. And what I really found interesting too, because I thought it was, more geared for the preschool ages of 3 to 5, but whenever my children went, I found out about the early Head Start and hitting on kids that were, 0 to 3, and that's really huge too. Let's touch on that a little bit. What kind of services are provided to kids that are in that age range?
The early Head Start, they do have some that are, center-based, where they actually have a classroom and teaching staff work with them. They do tummy time. Probably Lindsay would be good to speak about that because her son was actually an early Head Start with the program.
Oh, awesome.
Yeah, my son started as early Head Start home-based, so the teacher would come to my house once a week and work with him on different skills, fine motor skills, large motor skills, social emotional skills, all kinds of different different areas of learning, I guess you could say. It also was a big benefit for me as a parent. I was a stay-at-home mom at the time, and they encouraged me to take some college classes, and Head Start paid for the classes for me.
Oh, wow.
Got me involved in that. And then when he turned 3, he easily transitioned right into the center-based program where he got the classroom experience. And that's, for my story, I started volunteering right away, got really into it with Head Start paying for my schooling along the way. And then I started becoming a substitute teacher, and then I was a teacher aide. I've been there now 7 years or 8 years going on, and now I'm the family advocate, so I've been firsthand experience of what a parent can become or do with the help of Head Start.
That's amazing. That's a really cool story. It really kind of encompasses so much of that. Head Start is, of course, about the children and wanting to help them to be as best prepared for entering into the school system, but it's also for the parents as well. It's for the entire family to really benefit them. How awesome is that? Okay. So how many centers are there up here? I know that there's Show Low Center, there's Pinetop Center, there's, let's read off the list of more local centers up here.
Snowflake.
We have Pinetop, Snowflake, Show Low, Springerville, Holbrook, and Winslow in our general area, but we have 26 altogether in our COG. And we serve almost 1,800 children and families this past year. like Lindsay said, with the education of those families, I believe 59 parents went on to get bachelorettes
Oh, wow.
with Head Start Helping. We had 587 parents receive associate's degrees, and then we had 657 parents receive their GED.
Oh, that's amazing.
Working
And
with
that's
them.
all funded
It's all through Head Start. Head Start helps pay for that to give parents an opportunity to help themselves and
advance,
advance.
yeah.
And we also have a lot of opportunity for parents at our local centers. They are able to become part of our parent boards, and we hold monthly meetings with the parents to let them know what we're doing in the classroom. They have a very lot of opportunity to come volunteer, suggest what they would like to see in the classroom as far as activities for their children.
So you have a say, you know,
Yeah,
you're
you really
involved
do.
in the
Parents have a
process.
say.
And it's really important that you know that we believe that parents are their children's first teachers, and we're a partner with the parent in educating the children. It's not just we're the teacher and they're the parent. It's really teaching the parent how to help and how to advocate for themselves and their child for when they move on to the bigger schools too.
Right.
We conduct parent-teacher conferences twice a year, and we do what's called home visits to get to know the families better, but other places don't have those kind of services for parents.
Right. Well, yeah, and I remember, you know, having those home visits and having an advocate come out and say, well, what are your goals? You know, what is it that you would like to work on? You know, where do you see yourself in 5 years? How can we help you to get there? And that's really kind of refreshing, because as a parent, you know, obviously your focus is on your children, number one, you know, day in, day out. And it's good to have, it's always good to have a balance, of course, but to have some focus put on you as an important factor in your child's life and how to better yourself to be an even better parent.
Right.
So that's what I thought was just so amazing about the program. And those numbers just speak volumes on how many people that you guys have been able to help and impact this community and the communities around us, you know, to help build stronger, better families. Very cool. Well, yeah, so tell me a little bit more. What can we go into detail on?
How about like trainings and stuff we offer parents? We do educational trainings for parents. This year we did some financial literacy webinars for the parents, helping them learn how to maybe balance their checkbook, start saving money to help them reach their goals. And then we also do family engagement nights, which parents help plan that along with me and the parent committee board. And we do fun things,
With our focus on like literacy.
school readiness goals.
Right.
Awesome. That's amazing too, being able to incorporate, and I know it was always within schedules that were workable for the parents too, to be able to, okay, let's make it so that it's easy for them to attend and be able to really take from this rather than having to pass it up because they have to go to work or, you know, it conflicts with other schedules. So
Yeah.
that's amazing. Very cool.
Yeah, and studies show our impact with children and getting them ready for kindergarten. For an example, math, 65%, well, they come in the fall, 30-40%, and by the time they leave in the fall, it's up in the 90s in all areas: math, science, cognitive literacy, language. We do serve 10% special needs children as well. And
very nice. Yeah, and one thing too that I thought was really beneficial for my kids, I mentioned before we started rolling here, but my kids, we kept them at home whenever they were infants, so they didn't have daycare, they didn't have that socialization with other children besides, you know, brother sister kind of stuff, and they get sick of each other pretty quick. But you know, being able to get them those type of skills too prior to going into kindergarten, I think was amazing, on top of how prepared they were whenever they went into kindergarten with the necessary educational skills that they needed of, counting and being able to talk with our kindergarten teachers, whenever they were first going in, of saying, oh my gosh, he got to 100, as opposed to, somebody who maybe didn't go through a preparedness program like this, that was maybe struggling to be able to meet those goals. And I think that's the ultimate goal of Head Start, is to really give them a head start. I love the name of it. It really just makes sense completely. Give them that head start to be able to be as prepared as possible going into the school system, and in so many ways, both educational, socially, and just being able to, integrate much more quickly into kindergarten and beyond.
Yeah, and our biggest focus is school readiness for the children going into kindergarten. We do a lot of transitions throughout the year that help parents and children transition into kindergarten, and the teachers, like you had mentioned, are just surprised at how much more the children know by just coming to our program than children who don't get services like that.
Right. So yeah, I definitely, I'm so glad that you guys came here to talk about this, because I definitely want to get more people to know about these services that you guys offer and how beneficial these programs can be for their children and their grandchildren, So get in touch with your local center, find out information. We'll have phone numbers posted for after the segment, so that way people can look into it and find out more, and hopefully be able to get their children enrolled, so that way they can also give their kids a head start into the school system. I'm going to keep going with that. Thank you guys so much for coming.
You're welcome.
I really
Thank you for having us,
Yeah.
and we appreciate it.
Thank you. And stay tuned. We'll be right back with Byron Lewis with North Country Healthcare. Welcome back to Compassion Speaks. Joining us now is Byron Lewis, the navigator for North Country Healthcare. Welcome.
Welcome, Stephanie. Thank you very much. Glad to be here this morning.
I'm very glad that you're here today, and I want you to just kind of jump into your title real quick, because navigator could mean so many things, but what do you do as the navigator?
I get asked that question quite a bit in a lot of different forums, and what I typically tell them is, as a navigator for health benefits, which is what I do for North Country, is helping people understand what their options are under the Affordable Care Act. For example, right now there's a new special enrollment period that's going to end April 30th. A lot of folks don't know about that. A lot of folks don't know that there's a penalty, and a lot of folks don't know what policies are available out there for them and what the costs are. And that's what I do, is I help them navigate through some of that maze.
Awesome, and very much needed, because there's a lot of confusion with this rolling out across the country, and people don't necessarily understand it. They feel lost in it. They don't know where to begin, what it all means, and so that's kind of your role, is to really help them to navigate the system. But I think you touched on something before we started. You are completely, what word did you use?
I'm unbiased.
You're unbiased.
I'm unbiased. When you come and visit with me, you're going to walk out of there not knowing whether I'm for or against it, because my job is to make sure that you know what your options are under the law. If I could take a minute, let's just try and depoliticize the Affordable Care Act. Back in 2010, Congress, House and Senate, passed it. Then it went to President Obama's desk, and he signed it into law. It became the law of the land. It was challenged by the Supreme Court, and the Supreme Court upheld it. And the consequences of that are right now that if you don't have health insurance, you're going to pay a penalty. And what I help people do is understand what their options are under the law.
So what would work best for them, completely dependent on their choice once those options are presented to them. But some people, it may not work for them to get covered.
Yeah, some people may want to go in the private sector. Some people may belong to a health ministry. I do want to clear one thing up right away. Working for North Country and as a navigator, I don't make a dime off of this. I don't get any referral for suggesting a policy, which I won't do, or turning you over to a broker. This is part of our outreach. It's something we do to make an impact and, you know, basically let people know what's out there and what can benefit them. For your situation in the Safe House, you know, many women may be coming in there that have lost insurance coverage or haven't had it to begin with. And you know, being a single mom or being a single individual or with a family and without insurance in today's world, that's a pretty scary thing.
It really is. There's a lot of there's just a lot of fear, I think, that goes into that, and for people who are not informed in what this all entails, it can
There's
be
a lot.
daunting. You know,
There's a lot.
they feel like, I can't understand it. I don't want to understand it. You know, I don't
You know-
even want to look into it. And so, you can come in and really save the day in this type of situation.
Well, I don't know
by-
about saving the day, but what I can let them do, you know, this is one of the things I find that is kind of amazing. A lot of folks don't understand how insurance works, how you pay a premium, you know, every single month, and then how you have a deductible, and then how the insurance kicks in, whether it's 60, 70, 80, 90%. Under the Affordable Care Act, there are some pretty cool things. One of them is there's no pre-existing conditions. You have cancer, you have any type of illness, you can still get coverage. Another thing I really like about it is there's no caps. So if you have $1 million cap on an insurance policy right now, once that $1 million is gone, which can go pretty quick, you know, no soup for you, you're out of coverage. Affordable Care Act eliminates that. And the other thing I think is a real positive is women and men, they're on the same playing field. It's pretty level. The questions that they're going to ask you when you're applying for a policy are pretty basic. They're going to ask you how much you make, where you live, how old you are, and whether or not you use tobacco. And tobacco is defined as 4 times a week or more.
Gotcha.
That's it. That's what's going to
Pretty
go into
easy process, right?
Well, and last year, this was amazing to me, is 84% of the people that applied for a plan in the marketplace received tax credits. In Arizona, the average tax credit for a person was about $155. Nationwide, it was a little bit higher, about $258. But that's because, according to all the information I've been given, Arizona's insurance costs, I mean, it still seems high, but it's lower than where it is most of the other places in the country.
Good to
And
know.
one thing about the Affordable Care Act on the policies, 96% of the people that enrolled last year re-enrolled this year. To me, that indicates that they were happy with what they got, or that
Some
they
type
couldn't
of
get it anywhere
satisfaction
else.
rate. Yeah,
you know.
exactly.
I think those things are important.
So do you have any testimonials or any stories that you can share of somebody that you've helped?
Yeah, there's a couple of them. A few years ago, there was a young woman that went to work for a company. She got insurance for the first time, and on her first well visit, she found out she had breast cancer. Well, she went in, and the doctors treated it well. It was aggressive, and she beat it. She beat it for 11 years.
Wow.
Well, then it came back, and when it came back, she knew the routine. She went in, the doctor started the treatment, and everything was great right up until the time the $1 million cap ran out. So what did she do? Same thing you or I would do. She went to the private sector, but no one could touch her, and you know why. Pre-existing condition. So she was able to find something in the marketplace. Another lady that I worked with was on COBRA insurance, and it was expiring. The challenge with her was that she had just had a kidney transplant. And as it was expiring, nobody in the private sector would pick her up. We were able to find her some help in the marketplace with a policy that kicked in the day her COBRA expired. And here's why it's really, really important to listen to the individuals that you're talking to. And this is why we do not, and I will not, recommend a policy to anyone. She told me she traveled a lot, and so I thought, you know, maybe let's look at a PPO, which means if you're in, you know, different geographical areas, you'll be covered rather than tied to a specific set location with an HMO. Well, her particular doctor was not part of the PPO plan. And as I asked her what she thought, she told me, I'll go with the HMO. And I said, well, why? You travel? And she said, you know, Byron, he's the doctor that saved my life. I'm not going to go anywhere else. you know what? And she was right.
Yeah.
Nobody knows their business better than they do.
Well, exactly. And I think that that's an important aspect to this is that, there's no recommendations. You are presenting options and opening doors for people so that they can make an informed decision for themselves.
I couldn't have said it any better. That's exactly what we do. A lot of folks are antagonistic toward the law, and I get that. And if that's the case, do what our president suggested, vote for change. If you like it, keep the status quo. But between now and whatever eventuality is out there, it's in your best interest and your family's best interest to know what your options are. Because if you don't have insurance and you aren't an exempted individual would be a Native American, or if you're in prison, or if you belong to one of these health ministries, or if you're not making enough. But outside of those few exemptions, you're going to be looking at a penalty. And the penalty can be, this coming year, can be pretty significant. It'll be 2% of your adjusted gross income, or your MAGI, or $495 or $395 per person, half of that for a kid.
Wow.
So one of the things I've told the folks is, look, here's what your penalty is going to be. And we can calculate that out pretty close. Here's what the lowest level bronze policy is going to be. If they're within a few $100s, why not consider the policy so that at least you have something for your money
Right.
in case it hits, and you avoid the penalty. If you pay the penalty, what do you have to show?
Yeah. Well, exactly. I think that a lot of people, like I've touched on already, it feels like a daunting type of situation. That what they do know about it, they feel like maybe they're going in on it alone. And by having somebody like you out there, that this is open to the public, just the general public, to be able to take advantage of this service that North Country Healthcare provides to help them to literally navigate through what the system is, and again present those options so that way they can decide what's best for them.
And I want to be clear on this too. This is not just me. This is a North Country initiative. North Country has 15 individual clinics located all across northern Arizona, from Bullhead City, over near the California-Nevada border, over here to Round Valley. In Navajo County, we have 4 different clinics. And in each one of these clinics, there are certified application counselors who have gone through some pretty intense training to know how to sit down and answer these questions. Now, that's on the Marketplace. Marketplace has an open and an ending for their enrollment periods. Medicaid, on the other hand, state, we call it Access as well, is open year-round. And there's a lot of individuals that aren't aware of their options that are there and what some of those things can provide. To help out, North Country also offers a sliding fee scale, which is a monetary discount. But Access, or Medicaid, is a real policy. You can get referrals, treatments, and we've seen a lot of disadvantaged individuals helped with that. Apache County, any given day, is the 10th poorest county in America. Navajo County is the 85th poorest county. The mean income difference between those two is really very, very slight. At the end of the day, what we try to do is help them understand that there's some hope out there, that they may be actually closer to insurance than they think. And
Than maybe they ever have been before.
we get a lot of them that have it for the actual first time, and that's kind of a thrill. And they're able to use it. That gives them a better quality of life, a better health outcome, and I think that contributes to the general well-being of a community. And that's, I think, what we're all after.
Awesome. Well, and we'll have all of the local location information, phone numbers for people to be able to get in contact with you guys. Byron, thank you so much for coming and talking about this today. I think it's a really important issue to get out to the local community here, so that way they can really be as informed as possible as they move forward with this.
Thank you.
Oh, wonderful. That's even better and gives them no excuse. It's already set. You just got to show up.
Thank you, Stephanie.
Thank you so much, Byron. And thank you for joining us today. And be sure to tune in next month to hear Compassion Speak.
The White Mountain Safe House is a private nonprofit program dedicated to providing shelter, care, and advocacy for victims of domestic violence. If you or anyone you know is in need of services, please contact our 24-hour hotline at 928-367-6017. If you would like to support our organization in any way, please visit our website for more information at wmsafehouse.org.